Yeah, hello and welcome to webinar series. Myself Shakti, and today's topic for discussion is all about just to understand the very early warning signs for kidneys health. For this discussion, I now welcome Dr. P.S. Valli Garu, who is our senior consultant nephrologist, transplant physician from Yashoda Hospital, Secunderabad unit. I welcome you, sir.
Thank you. Good afternoon, everyone.
Yes. And I also like to extend my welcome to welcome our speakers, and I request you all to introduce yourself. Yes, over to you, Esther.
Good afternoon, everyone. My name is Esther. I completed MSc Nursing. Currently, I'm working in Medwin College of Nursing. I really thank you for Shanti ma'am for giving me this opportunity.
Yes,
over to you,
Ashwita. Yes.
Good afternoon, everyone. My name is Shweta Charlotte. I am working in Yashoda Lakshmi College of Nursing, which is at Kaudavali. And thank you for giving me this opportunity. I'm really looking forward to learn a lot from this particular topic. Thank you so much.
Yes. Sulochana.
Hi, good afternoon. My doctor, thanks for giving me this opportunity to shine. And I'm Sulochana. I'll be the speaker for today's session with Dr. Valli sir. I'm looking forward to our great.
So going forward, let us move on with the first slide. As we know about prevalence, helps understand the burden of disease. So going forward to Valli sir, to understand, is this condition turning into a global concern because it has surpassed diabetes, in overall way? Yes. So what do you say?
So chronic kidney disease is a significant global health burden. It is known as global health burden because 1 in every 20 Indians might be labeled as chronic kidney disease in their lifespan. And across the world, 1 in 15 people might be labeled as CKD in their lifetime. Another most important statistics which all should understand and apply is every 30 may develop some form of kidney problem because diabetes is the most important cause of chronic kidney disease. So just remember one statistic, 1 in 20 people in general population can be labeled as chronic kidney disease, which is not a small number. And more importantly, all across the globe, as on date, there are more than 800 million CKD population. So it's a huge burden. And I will tell you other statistics. It is the 7th leading cause of death all across the world. Therefore, CKD is a true, concernful, demand-attractive health issue all across the world.
Yes, a very valid insight about the prevalence. And moving on, yes, Esther, we'll see what we have in the rest of the session. Yes, over to you, Esther.
So good afternoon, sir. So when can we say that there is a kidney dysfunction? And what is the estimated GFR rate, sir? And what does UACR mean, sir? What is the ratio of UACR? Glad to know from this.
Very well.
Yes, and
it's a fantastic
question. We wish to understand here, how do we currently assess the patients? Like, are these a clinical very prime indicator to assess our patients when patient comes to you, sir? Yes, what you say?
Very well. First, we need to understand that kidney disease is a silent killer. 90% patients don't have any symptoms for kidney disease. Why? Because kidney is like our cell phone. The way our cell phone works, for our cell phone also, till 90% of kidney cell phone charging is over, cell phone doesn't emit any amount of fluids. The same way the kidney also behaves. That's the reason kidney disease is prima facie a very silent disease. The only way to detect kidney disease is by performing investigations. There are only 3 important investigations to pick up kidney health status and to assess kidney health status and scientific background. The first one is serum creatinine. Serum creatinine is a marker which is produced in everyone's body. When kidney function is robust, the creatinine will maintain within the normal limits. That means less than 1.1 for women, less than 1.2 for males. In proportion to the kidney dysfunction, the creatinine also starts increasing. Therefore, the number 1 marker is serum creatinine. The second marker is eGFR. People presume that eGFR is a test, but eGFR is a formula. So for eGFR, it requires 3 variables: gender, age, and serum creatinine. Basing on gender, age, serum creatinine, there is a formula known as CKD-EPA formula which is going to give GFR. The normal eGFR is 90, but once again, GFR starts declining in par with the age. Therefore, for a person of 70 years, the normal GFR is 70. So the third important test is spot urine albumin creatinine ratio. It's a wonderful test. The spot urine albumin creatinine ratio is the very kidney disease. People say, and science says, that spot urine albumin creatinine ratio becomes abnormal 6 years prior to abnormalities in the creatinine. Therefore, the best methodology to pick up kidney disease at the early stage is not the creatinine, not the GFR, but checking for spot urine albumin creatinine ratio. And the normal ratio is less than 30. And you need not do all these kidney tests in everyone. The individuals who are, that means diabetics, hypertensives, age more than 50 years, family history of kidney disease, history of chronic uses of painkillers. These are the 5 types of population who need to undergo weekly test, creatinine, GFR, and spot urine albumin creatinine ratio at least once in a year.
Yes, very great to understand. And yes, as you said, the few clinical indicators, I think, sir, when, when a person comes to you with a few likely comorbidities, then definitely the patients should opt out to these investigations to come to the condition.
And then there is one addition, ultrasound is only optional. Kidney biopsy is required in very few individuals. Therefore, the 3 primary indications are creatinine, GFR, and spot urine albumin creatinine ratio. Basing on the necessity, we will be doing ultrasound and then kidney biopsy.
Yes. Shweta, over to you. What you understand since creatinine has been, explained by sir.
So, sir, as we did understand or we did know how to assess the patients, so I'd like to ask and know about if elevated creatinine is the only reason, or is it the only sole criteria for any kidney problem, or because it does vary a lot within person to person, like age, gender, muscle mass. So everybody has different type of normal creatinines for them, I think. So could you please help us to know if elevated creatinine is sole reason for or sole criteria for a kidney problem?
Good. Once again, a good question, great question, rather. Serum creatinine is a false marker. It's the greatest deceiver. It is known as greatest deceiver. Why? Because serum creatinine doesn't increase until 50% of kidney function has been lost. Therefore, for a person to have a creatinine of 1.4, 50% of kidney reserve has to be depleted. That means we are dealing about a very famous marker which is not trustworthy. We are dealing about serum creatinine, which is very much talked about, but still it's not credible, because until 50% of kidney power has been lost, creatinine don't increase. Number 1. Let us imagine a person who is having very thin muscle mass, creatinine of 1.1, still it is significant elevation. Rather, for a person who is going to gym, who is having excellent muscle mass, creatinine of 1.4 can be normal, because creatinine depends not only on the kidney, but also the muscle, because muscle is the root factor which produces creatinine. Therefore, never ever believe the creatinine. Creatinine alone can never assist kidney function. That's the reason we say the conglomeration of creatinine, GFR, and then complete urine examination, spot urine albumin creatinine ratio put together can define kidney health. And more importantly, for a person of 88, even 1.1 is also very significant. That indicates abnormality. Rather, for a person of 50 years, 1.1 is normal. Therefore, never ever depends on the creatinine. It's a false marker.
Thanks for clearing this doubt. Yes, Shweta, you would like to quote?
Thank you so much, sir. I did have a lot of confusion in that when you did mention that, and now it's pretty much clarified. Thank you so much, sir.
Yes, yes, Sulochana, what you wish to understand, yes, you can present this. Yeah, over to you.
Really, this thing I was very important, what is me more selecting that goes investigation, sir. So, which helps me more how much I talk about the kidney function. So, is it often develops already our serenity? There's not some men who saving I guess I mean, some do want to comment and we get beautification. Could you please tell me a bit more about what are the early warning signs of kidney dysfunction?
Probably this is the most important question what
Yes.
I am interrogated with every day. What are the symptoms of kidney disease? The greatest symptom is lack of symptoms because 90% of patients, kidney patients, they don't manifest any symptoms even though creatinine is 7 or 8. This is a very common experience, rather heart-wrenching experience for nephrologists. People walking into our rooms who are apparently normal, who is apparently more fitter than me, but still the creatinine is 7 because creatinine is a deceiving marker. So what are the symptoms? The most important symptom is swelling of legs during the evenings or swelling of the face during the early morning. The swellings occur because of accumulation of fluid. Fluid accumulates because of kidney failure. Once kidney function goes down, our human body silently accumulates the water. Then body behaves like a water bath. When you're sitting for a long time, the swelling of legs, pedal edema occurs. When you're sleeping, the swelling goes to face. It's a gravity phenomenon. Therefore, swelling of legs or facial puffiness, or more importantly, selective puffiness of eyes around the eyelids. That is number one. Second marker is seeing excess amount of foam. Don't worry, foam is a common manifestation. Every human being has a foam, but usually you have only transient foam. But the foam, which is almost occupying half of the commode, or despite 2 or 3 flushings, if still foam is persisting for minutes together, hours together, that's abnormality. So it's not a common foam, but abnormal foam. The foam should appear as if once we open a big Coca-Cola bottle, the way the foam appears,
Yes.
the same foam, the foam should appear. Not every foam should scare you. Third important thing is, the most important of kidney thing is presence of hypertension in a young man. That means, if at all you happen to see in your relatives who is having hypertension at younger age group less than 45 years of age, please check for kidney functions because at least 20% of people who develop hypertension at young age might having some kidney issues. Therefore, hypertension in young is the greatest clue that of kidney function. Third important marker is when the creatinine is so much elevated, creatinine is more than 5, creatinine is more than 6, that patients tend to develop intractable vomitings. That means vomitings which persist for days together. If the creatinine is very high, patients tend to develop breathing issues. That means patients will be happy in the morning hours. When they go back and lie down at night, they tend to develop so much amount of orthopnea. The word orthopnea indicates breathing problem during the nights. Therefore, any person who is having young onset hypertension, swelling of legs, and then who is complaining of breathing problem only at nights, please be aware of kidney functions. And more importantly, complete lack of appetite. Absolute lack of appetite. There are only 3 conditions which can produce absolute lack of appetite. One of the indication is kidney disorder. Other symptoms are having dryness of skin. Simple thing, the most important symptom is lack of symptom, and one of the common symptom is pedal edema.
Yes, very greatly, just interestingly, we are learning a lot of few, myth versus fact, like as you cleared about foamy urine, transient in nature and pedal edema, and somebody who presents with a lack of symptoms. Yeah, I like the word as well. Yes. Yeah, over to you, Shweta, for, I think it is Esther. Yeah, Esther. Yeah.
So nowadays, we think that 50 to 60 years of age, people are affected with kidney diseases, sir. Generally, recently, the younger generation is also suffering with kidney problems, sir. So what are the risk factors, sir? And who should get screened? So could you...
Wonderful. Very good pertinent question from community point of view. There are 5 sets of individuals who are more prone for kidney disorders. Number 1 is diabetes. Trust me, diabetes is the most common cause of kidney disease in the world, in India, in Telangana, in Hyderabad. Wherever you go, the most common of kidney disease is diabetes. 50% of, diabetes. 50% of the patients who are on dialysis are just because of diabetes, which is a preventable disease. People end up into dialysis because they neglect and they ignore their diabetes. Therefore, the first most important cause is diabetes, which is long-standing and poorly controlled. Unrespected diabetes paves the path to kidney failure. Second thing is long-standing hypertension. Kidneys are very sensitive filters. Each kidney is having 1 million filters. If the BP is not well controlled, the same BP is going to transmit the pressure and going to damage the sensitive filters. Therefore, long-standing, poorly controlled hypertension is second most common cause. Third one is people who are having long-standing family history. For example, mother is having kidney disease, son might get. Father is having kidney disease, son might get. There is one disease known as ADPKD. It's nothing but polycystic kidney disease which runs in the family. Therefore, third important reason is genetic disorders. And the fourth important cause is indiscriminate and judicious use of painkillers. It's very common in tropical countries like India that people just walk to medical shops and get a bunch of ibuprofen or diclofenac. For 1 to 2 days, nothing will happen. For 5 days, nothing will happen. All of us would have taken diclofenac enough number of times. But those people who get addicted to diclofenac, who continue to take diclofenac without medical supervision for years together, they are going to land up in kidney failure. That is known as analgesic nephropathy. And the fifth most interesting cause of kidney failure in Telangana is fluorosis. There are some districts in Telangana such as Nalgonda, wherein the groundwater is contaminated with fluoride. Therefore, whenever you are living in such an area where groundwater is contaminated with agricultural toxins or with fluoride, it can also develop kidney failure, which is known as kidney failure U. Therefore, these are the 5 most important risk factors for kidney disease.
Yes, sir. I think we have not seen this in even, when I was just preparing this slide very rightly, as you said. Yeah, these are very important. I think we urge all the viewers just to keep these, causes and risk at mind. Yes. Yeah. Thank you, sir, for your very, tremendous, valuable insight on the same. And yes, what do you, Shweta? Yes, I think UACR and creatinine has been dealt by, sir. And if you would like to ask for CUE. Yep.
Yes. So, sir, as you did mention previously, that there are actually no symptoms which are thoroughly seen. So, is there any early screening that protects kidney health, or is there the regular COA serum once the kidney is totally affected? That is when we go for all these tests. Is there any early screening that we can do, or is there anything else?
Very well. Kidney is a very complex structure, but screening is very easy. You don't require any MRI, you don't require any CT scan.
Yes.
Early detection of kidney disease requires only 3 mantras. 3 simple tests which can be done in a span of almost 600 rupees. One is serum creatinine and GFR. Second one is complete urine examination. And third screening test is part urine albumin creatinine ratio. By utilizing these 3 screening tests, 95% of kidney disorders can be picked up. If you pick up at this stage, at least 90% of people are going to have normal lifespan. Therefore, kidney disease can be screened out with the conglomeration of CUE, creatinine, GFR, and then part urine albumin creatinine ratio.
I think I have just taken this slide from your talk only, sir, because I was just going through. It was so touchy that I have seen all of them. Thank you, sir, for your great videos which you are publishing. I think very short, very crisp, and very interesting. Yes. Yes. So going forward, I've also seen your video on this. Until today, I did not know that potassium, high potassium is, seen in a potato also. So I was just hearing about your potato ramana story, what you were trying to, to say. Yes. So what the awareness on optimizing potassium foods for kidney patients or somebody who is very healthy. What is a keynote you would like to give them? So like I have heard of you saying potato and fenugreek seeds, how one should take, whether they should take in a moderate portion or in a controlled portion, sir. Yes, over to you.
Number 1, I want to make it one disclaimer. Potassium is good for normal individuals. As long as your kidney power is good, potassium is healthy. The problem comes when your kidney function goes down. When your kidney function goes down, in proportion to loss of your kidney power, the potassium also starts accumulating because kidney plays very important pivotal role in excretion of potassium. Therefore, every kidney failure patient should be cautious about potassium. Then what are the foods which are rich in potassium? Number 1, fruits. All fruits are universally rich in potassium. Any product on the earth which uses photosynthesis has potassium because photosynthesis byproduct is nothing but potassium. Therefore, fruits use rich amount of photosynthesis. Therefore, they are rich in potassium. The fruits which are low in potassium are apple, pineapple, papaya, guava, and then berries. These are the 5 fruits which are having less amount of potassium, and only these 5 fruits in limited quantities has to be allowed. All other fruits has to be avoided. And more importantly, interestingly, coconut water is a rich source of potassium. Coconut water is good for you and for me, but not for kidney failure patients. So the rule of thumb is kidney failure patients should avoid coconut water because a glass of coconut water contains huge amount of potassium, which can be sometimes different between life and death. And third important thing is other potassium rich foods, any vegetable which is coming from the ground, such as potato, sweet potato, radish, is also rich in potassium. Therefore, potato has to be consumed only by making into small pieces and then boiling in water for 1 hour and then cooking. Because this is not a leaching technique. Leaching technique will try to liberate the potassium out of the potato. And then Karela is one of the myths that if you take Karela, you will be having good health. Karela will give good health for diabetics, but not for kidney failure patients, because this Karela has got huge amount of potassium. So be cautious about fruits, avoid coconut water, be cautious about tuberous vegetables such as potato and sweet potato, and always break your love with regard to Karela. This will protect you from potassium.
Yes, very interesting to know about the bitter gourd as well. Yes. Yes, Lochna, I think we are just reaching to the nearest of the session. Yes. So, Lochna, what do you?
It's an interesting part. So, I'm forgetting this start. So, on the point forward, so some is playing the evening by evening story. Some in targeting the plan and a little bit the jurisdiction. So, can you please tell me how should one consume a perfect goal for sedation?
So your question is how much amount of protein food a normal person should take? This is the most common question what my gym colleagues will ask. And almost no lecture is complete without this question, because there has been a lot of myths that you eat some amount of good protein, but other person says if you eat high protein, your kidneys are at failure. Trust me, the simple rule of thumb is rule of 1. Any normal person whose kidney health is normal can happily take 1 gram per kg per day. That means if my weight is 74 kgs, I can take up to 74 grams of protein. But the safe limit is just reduce it by 20%. That means make it 80% of your body weight. That means 0.8 grams per kg per day, extremely safe for kidneys. For people who are pregnant, who are nursing mothers, they can happily cross 1 gram also. Therefore, 1 gram per kg per day is the safest limit. Kidneys will get damaged if a person continuously takes more than 2 grams per kg per day. Therefore, the toxic dose is 2 grams per kg per day. So you know what egg white will contain? Egg white will contain only 6 grams per day. Therefore, a person cannot damage kidneys just by taking good amount of protein. It becomes, if you take against nature means a person who is taking almost 1 kg of chicken every day and then 6 eggs whites and who is trying to become a Mike Tyson. Protein is but not for us. Therefore, you can happily take protein, but take good protein. Never ever take the so-called protein sold in gyms, because their kidney failure happens not because of the protein powder sold in the gyms, but because of lead contamination. Because protein powders in the gym are not made in medical grade factories. They are made in local factories.
Yes.
When a protein powder is made in the local factories, contaminants such as lead will join. Therefore, in recently Pune also, people had a plethora of kidney failure because of taking gym product from a particular gym. Once again, the research told that it is because of the lead. Therefore, take protein, respect the rule of 1 gram per kg per day. Each egg will contain 6 grams per 1 egg, like that you can calculate.
Yes. Okay. And sir, how about consuming these fish and other seafoods? Like, do you suggest either?
Well, regarding this wonderful question, I forgot to tell about that. Regarding protein, there are 2 types of protein: good protein, bad protein. Good protein is any vegetable protein is excellent good protein. The best form of protein human can get is egg white. The albumin which is present in the egg white is a wonderful, safest protein. Unfortunately, vegetarians are divided of that, but it's a one of the high biological protein, safest protein is the egg white. Chicken, fish, they are categorized under lean meats. That's the reason Bengalis live longer than other people. Why? Because they eat good amount of lean protein. That's the reason the life expectancy for Kerala people is very high, because they eat one of the finest forms of protein, that is fish protein. Regarding mutton, yes, mutton is not a good protein. Red meat is not good. Red meat is not good not only for kidneys, but excessive consumption of red meat leads to colon cancer. Of course, I come from a community where it is too much consumed, but still we say that red meat has to be reduced. Therefore, the safest protein are vegetable protein, soya chunks, the mushrooms, and then egg whites, and then chicken or fish. These are the 5 forms of best forms of protein.
I think I will also just find out Kerala's life expectancy you have said. So do I just would like to know about my state, which is West Bengal.
Oh,
Yes. Yeah, that's a very interesting fact about it. Yes, yes, sir. And then one more slide, and then the end. Yes, sir. Over to you.
So does staying hydrated aid waste filtration, sir? So what is the optimal daily water intake, sir, for healthy adults?
Once again, about the final question. Basically, it's one of the greatest myths that drink more amount of water, flush your kidneys. Water cannot flush kidneys if you take more than 6 liters or so. The ordinary person who is staying in India, in cold weather, take 2.5 liters, your kidneys are properly flushed. In summer, you take up to 3.5 liters, more than sufficient. There is no point, there is no benefits of drinking more than 3.5 liters per day. Therefore, there is no point that drink so much amount of water. Drinking water is only remedy for constipation, but never kidney. Therefore, any person in winter season has to take 2.5 liters. In summer seasons, probably up to 3.5 liters is more than sufficient. Rather, if we have kidney stones, then increase by another 500 ml per 4 liters. Therefore, for a person who is not having kidney stones, up to 3 liters. Who are having kidney stones, up to 4 liters. There is no benefit of exceeding the water intake beyond this.
It's very greatly we are understanding and knowing lot of myth versus fact, and we also too had a lot of misconception. Yes, I think yes. The last slide, Shweta, take over, and I think we end after this. Yeah.
Perfect, sir. So, apart from seeking help from the doctor, or to summarize the topic in a very neat way, so can I know if there are any preventive tips so that we don't get into kidney problems at all? So, is there any preventive tips that we can follow and not have the kidney dysfunctioning?
Wonderful. The first preventive step is we cautiously support the white products. The white products are white maida, white salt, and white sugar. If at all, we can train ourselves to break our heart from these 3 white things. That means consume less than 5 grams of salt per day. Better to avoid maida or processed food, or reduce outside food which contains huge amount of processed maida. And then, if we can compensate the brown rice with white rice, or mixture of brown rice and white rice, and decrease the white rice consumption, that's the number one. Second thing is, respect your diabetes. Don't worry about diabetes. Everyone on the earth had supposed to get diabetes in one other day. Because as we age, we are supposed to get diabetes. Like that. But if you're not diabetic, respect your diabetes, get treated early. Make sure that your lucky number is 7. 7 means your HbA1c should be less than 7. Therefore, for our relatives who are diabetics, tell that the lucky number should be 7, irrespective of that birth date. Because their HbA1c of less than 7 is going to safeguard the kidneys. Second thing is, respect your blood pressure, monitor it. If at all you are hypertensive, make sure that your upper BP is less than 130 and lower BP is less than 80. And annually, screen for CUE, spot urine albumin creatinine ratio, eGFR and creatinine. And more importantly, maintain that you have physical activity of 150 minutes per week. You need not go to gym every day. Just make sure that every week you achieve a target of 150 minutes. By following these 5 simple mantras, at least we can make sure that our kidneys are in good health.
Yeah, very interesting, sir. And I urge all the viewers to just see this, CKD stages for your reference. You can just copy them as well. This is how the stages have been described. And when you see a nephrologist prescribing CKD 1, 2, that's how, this is all about the reference about. Now, yes, I request everybody to just refer www.yashodahospitals.com for more academics and health update, also short reels, and also, look for patient testimonials, because learning, get everything through learning, and knowledge is power, nothing else. Yeah, so thank you so much, sir, for your beautiful and very valuable session. And I thank all the, speakers, and we end the session. Thank you.
Thank you.
Thank you so much. That enthusiasm.
Thank you, sir. It was very interesting, sir. And we just cannot, wrap up within half an hour of this time. We would love to have many more sessions from your end, sir. Very, very interesting, sir. Thank you.
Thank you.
We end the session. Yeah. Thank you.